Chiropractic treatment is tricky, and I'll tell you why. I don't really have any problems with good chiropractors working on your lower back. If it's somebody who knows what they're doing, actually can be helpful. So let's talk about the injections for the spine now. What are the injections for the spine? Why do we do this? So physical therapy can be very effective in addressing the underlying problems. The question is it going to be long-term or is it going to be temporary relief? Hello, this is Dr. Yevgeniy Khavkin. I'm an American board-certified neurosurgeon and neurospine surgeon. Welcome to my YouTube channel. So today we're going to talk about what can be done to avoid surgery. I always say that the best spine surgery is the one you can avoid. But what if you're in pain? What if you're hurting? What can you do to address that? So there's few things that I always recommend you try first before consider any kind of surgical treatment. We call them conservative treatment options. What's conservative treatment option? Anything non-surgical. So what that includes, and a lot of people know about the physical therapy, or physiotherapy as they call this here, there's a possibility of injections. So there's a different kind of injections that can be used. We also started using stem cell injections. There's a lot of misconception about stem cells, what they're being used for, what the indication. They can be very, very effective if they're used properly. And it's very important to have the proper indication and the proper utilization of the stem cell modalities that we have available. Some people try to use a chiropractic treatment as well. Chiropractic treatment is tricky, and I'll tell you why. I don't really have any problems with good chiropractors working on your lower back. If it's somebody who knows what they're doing, actually can be helpful. I'm very much against chiropractic treatment for your neck. The reason why, because a lot of chiropractors do manipulations without proper workup of the condition, without getting x-ray, without getting a CT scan, and without getting the MRI. And so they don't really know a lot of times if there's any signs of any compression of the nerve root, compression of the spinal cord. And unfortunately, what I've seen in over 25 years of doing this, I've seen a number of patients who got worse as a result of chiropractic treatment, who lost function, who had a nerve damage, who had paralysis, which is obviously extreme cases, but unfortunately I've seen several cases where the spinal cord was getting pinched as a result of the chiropractic treatment. There's also blood vessels in the back of the head called vertebral arteries. So when you do manipulations of the spine, of the neck, there's always a possibility that you can injure those arteries, a condition called dissection, the vertebral artery dissection, that can lead to stroke and possibly even death. And unfortunately, I've seen all of this before. So my recommendation is against chiropractic treatment for the neck, just because of how potentially high risk of this treatment. The other parts of the body, thoracic spine, lumbar spine, I think if it's a competent chiropractor who does things well, based on the imaging studies, based on the pathology, I think it's relatively safe. So physiotherapy is usually my preferred first line of treatment for any conditions for the neck and for the lower back. Why? Because if you're working with actually a good physical therapist, which is very important to have somebody who specializes in the treatment of spine conditions, what they do is that they provide you with a guidance, a set of exercises to strengthen your core muscles, to build up the strength, the core support for your neck and for your lower back through the exercises, through the resistance, through a variety of equipment that they have that would allow you to actually build up the strength, build up the core, and decrease the inflammation. So physical therapy can be very effective in addressing the underlying problems. The question is it going to be long-term or is it going to be temporary relief? So the only way to find out is really to try, and it's usually my recommendation. And I'm very particular about which physical therapists I recommend. I work with a lot of great therapists. I've also worked with therapists who I don't think they quite understand the biomechanics of the neck, of the lower back. So my job in my practice also is point my patients in the right direction and connect them with the right specialists who would actually provide them with the right guidance and the right treatment for physiotherapy specifically. So let's talk about the injections for the spine now. What are the injections for the spine? Why do we do this? So injection essentially is a way to deliver usually anti-inflammatory medication. There's a variety of medications that we can use, deliver to the soft tissue, deliver to the spine. Some of them can be done just with palpation, with feeling the area. Some of them can be done under ultrasound, and sometimes we use fluoroscopy or the X-ray, the C-arm, to have a precise delivery of the medication close to the spine. The more common locations for the delivery medications: epidural injection, facet blocks, the caudal injections. So we don't deliver them directly into the, obviously, nerves, into the spinal cord, but in the area around the neural structures, around the spine structures, to decrease the inflammation. The injections can be done by a surgeon, they can be done by interventional radiologists, they can be done by pain management specialists. In America, for example, pain management specialists can be either anesthesiologists who train to become pain management doctors, or very commonly you have radiologists who do also pain injections. And another path to become pain doctor is going from the rehab background. It's called physiatrists, rehab specialists that receive extra training to be able to deliver the medications directly to the spine. But all of those specialists, their focus is to do the injections, to deliver the anti-inflammatory medications to the spine to decrease the inflammation. The great thing about this is that it's usually effective. Again, the question is for how long? Is it a short-term result? Is it a long-term result? And my recommendation usually to try it, to see how well you respond to this. And then based on the response to the injection, I usually make an assessment whether or not you should continue with this path, continue with more injections, or maybe it's not justified, and maybe the next step would be to consider surgical treatment. Now, the topic that a lot of people are confused about, and there's a lot of fascination about this, is stem cells. What are the stem cells? Why are they being used? Now, we use stem cells for spine. We have been for a while. There is definitely the indications for the usage has been expanding, but it's very important to know exactly what kind of stem cell to use, how to deliver it, what works, what doesn't work. And so for each of my patients that I feel the stem cells are indicated, I do a thorough education on exactly what are the options, what are the pros, what are the cons, what are the indications, so that my patient can actually make an educated decision. So in summary, I feel it's very important to know and to utilize non-surgical treatments before considering any surgery. The only exception to this rule is that when somebody has any kind of signs of nerve damage. So if, for example, you have any weakness, you have numbness, you have any signs of muscle atrophy, difficulty walking, any signs of the compression of the spinal cord called myelopathy, and in one of the episodes we're going to talk specifically about what's called cervical conditions or cervical myelopathy specifically, because unfortunately it's a fairly common condition and a lot of times unrecognized condition. So if you have any of those conditions with the signs of the nerve damage or the compression of the spinal cord, I tend to be a lot more aggressive with recommending surgery, because if you don't do the surgery within a certain window, you may potentially lose this chance, the opportunity to regain the function and get somebody back to being functional, enjoying their life. So thank you so much for watching this to the end. Please subscribe to my channel. If you have any questions about what we just talked about, please leave the comments. I'll personally review them and I'll get back to you with the answers.